yes, I am a political wonk.
Excellent. Welcome. Thanks for coming today. Lori Williams, you're the next one on my screen.
Sorry, I'm also eating breakfast.
I'm sorry.
Hi. I just moved to the district about 6 months ago. I was in Lake Oswego. Before that, I lived outside of Washington, D.C. So obviously, I'm interested in politics. And I also work with a climate change group through the OLCV.
Great.
So I'm just interested. And I think I met you somewhere at one of the women's, Democratic women's groups, and was very impressed. So I'm very glad you're my representative now.
Well, I'm so glad you're here. Thank you. Jill Slansky, nice to see you. How are you?
You're muted.
I'm fine, thank you. I am a fairly new resident in Northwest Portland and just wanted to hear what you had to say.
Wonderful. Thanks for coming. Raymond.
I'm a constituent of yours.
Wonderful. So good to meet you in this virtual crazy world. And it would be great too if I ever knocked on your door, let me know, because we did get to many thousands of doors before COVID-19. So that was a good thing. And I know Debbie K, will you introduce yourself? Good morning. Uh-oh, you're muted, Debbie.
Thank you. Debbie Kay, I am a neighbor, pleased to be a neighbor of Representative Dexter. And I'm also president of the League of Women Voters of Portland.
Thank you.
And therefore, very interested in the politics of our area.
And very involved for sure. Thank you for coming. Adam Gretzinger, is that correct? Great, nice to see you this morning. So I think, do you want to say hi, or you can just wave if you don't want to? Perfect, nice to see you. Christy, I'm gonna try your name. Dukin? No, I'm not gonna say it, sorry. Please tell me how to say it though.
Dyking, thank you. Good morning, Representative Dexter. Glad to be here. I live in Cedar Mill. I've been here about 30 years. I retired from the Hillsborough School District as a teacher. And my main area of concern is racial justice. That's where I'm most active.
Great, thank you so much for joining. We've got a lot of folks out in Cedar Mill who are very involved. Goon, it's so good to see you. Goon Denhart, good morning.
Good morning. So nice to meet you in person here.
Yeah.
I'm in your district. I live in the Pearl, and I'm really interested to get to know you and see what you have to say today.
Great, thank you so much. I think Pamela has connected us indirectly a couple of times, Kislak, so nice to see you. Jennifer Saunders, good morning.
Hi, I'm a constituent and neighbor, and just in light of the last several years, I want to continue to be a little more politically engaged, and has been my history. So here I am.
Wonderful. Thank you so much for coming. And as Beaverton City Councilor, Nadia Hassan, welcome.
Hey, good morning. My parents live in your district, so I'm here to represent them.
No, I'm so excited you're here. Good morning.
Yeah.
Super excited to have you on the City Council. Phil Goldsmith. Uh-oh, you're on mute, sir.
Sorry about that. Good morning, Representative Dexter. So I live in the Alphabet District and have been here for about 4 years and was previously in the district which used to be Representative Williamson's. And I am interested in housing related issues, racial justice issues, and consumer issues.
Great, thank you for coming.
Sure.
Joe Lopez, and I love how you had yourself unmuted in anticipation.
Yeah, I went ahead and unmuted there. It's nice to see you. Thanks for doing this. This is great. I really appreciate this. I'm excited to hear about your plans for healthcare and the way you're going to do things. I don't know how you're going to do that. If you pull that off, that'd be awesome. But I'm talking about the method that we pay for services and how it's delivered and the incentives that are there. I'd like to hear more about that sometime. But and then the other thing we're interested in here is just the vaccine and how that's going. You know, we have quite a story. We had something, I'm not going to tell you the details of it, but boy, it's we got a shot. We got a vaccine, but it was kind of a funny journey. And so I guess our impression is like it'd be nice to get everybody more involved in it. But anyway, thank you so much for doing this. Thank you.
No, it's my pleasure. Yeah, we'll probably touch on both those items. Renate, good morning. I think you're on mute too. I'm so sorry.
Good morning.
Good morning.
Hi. I have retired from nursing after 37 years, and I voted for you, and I'm interested to get to know you personally and see what you can do for us for the vaccination effort and for the health for everybody.
Oh, thank you so much for being here, and thank you for your support. So we saw Councillor Deb Lev. Good morning.
Good morning. Thanks for doing this again, and I'm interested in hearing more about your plans, and particularly interested in climate change issues, and wondering how you're feeling about the bills that are proposed. So,
great. We'll talk about that, I hope too. So, and John McDonald, good morning.
Good morning. I'm a Washington County PCP Vice Chair of the Veterans Caucus for the Oregon Democratic Party.
Wonderful. Thanks for being here. Yeah, the PCPs in Washington County are pretty darn active, so that's great. Not that they're not everywhere. Oh my gosh, there's so many people. Okay, so I want to make sure we talk to everyone, and I also want to be mindful of time. So we'll go through 9:15, and then if we haven't if everyone hasn't introduced themselves, I'll start doing the questions. Elizabeth Wilson, you're next.
Hi, good morning. I'm not actually from your district, but I do live in Central Oregon, and I work with homeless youth and a lot with the Alliance. And so I'm just here to listen. And
wonderful.
Thanks for having us.
Oh my gosh, thank you for that work. I know Leslie Kenny-Geyer was hugely involved too. So hope to help lift that up. Thank you. Susan Mates.
Okay, I'll try and start my video. Oops, it's not gonna work. My connection's kind of wonky, so I keep it off, but I do live in your district. You did knock on my door when you were running for election, and we were very impressed with you and so happy to see you here. I follow air quality for the League of Women Voters, and I'm especially interested in the indirect source bill.
Great. You obviously are following closely because we've hardly even talked about that yet. So yeah, that's great. And Joanne's iPad. And I can't see if you're waving, so I'll move to Eve Rosenfeld, and then we'll go back to Joanne if I see you go off mute.
Morning. I'm happy to be very happy that you're doing this. Right on the top of my head, I applaud Governor Brown's decision to move teachers higher up in the vaccination list. I think it's very, very important that we get those children back to school. And some of us who are plus 80, as I am, are in a position to take care of ourselves in our own places. We can more easily isolate. And I'm very interested in what you're going to be doing, the legislature directions. I am interested in housing as well as health issues and racial justice.
Great. Thank you so much for sharing your perspective and being here this morning. Joel Shapiro.
Hi, I'm a longtime Rural District resident and longtime participant in public policy issues. In fact, I was a staffer for your predecessor, two predecessors ago, before Representative Greenlick, Chris Beck, when I was just out of law school, and also served as chief counsel to Senator Wyden, where I was involved in a lot of different issues, but now my focus is mainly, as you know, on human trafficking issues.
Yeah, no, it's so good to see you. Thank you for joining us.
Thanks.
Thank you. And I can't remember, Jim Moreland, did we? Now I'm starting to forget who I've introduced. So if you're not off, there you are.
Hi, actually, this is Jim's wife, Judy, and I'm interested in healthcare issues as they relate to our state, and be interested in your perspective. I'm very glad you're doing this too.
Thank you so much. And Kin?
Oh, yes, I'm here. Thank you so much for doing this. I'm very interested in hear about and learn more what our areas are doing. I am a constituent in the neighborhood, so looking forward to hear and learn more. Thank you for doing this.
No, it's my pleasure. Thank you so much for joining. And I see Corianne Wynn, and I don't know if it's Winters or Winterfeld or so. Corianne.
Yeah, hi, it's actually, it is Corianne Wind. I just, I live in the Oak Hills neighborhood, north of 26, and just want to keep up with what's going on in the area. For my day job, I actually work for DEQ and I do climate policy. So that is my professional interest. I run, yeah, if you're familiar with the Clean Fuels program, I run the Clean Fuels program.
Thank you so much. I'm glad to have you. So I am starting to see that folks are going to have a short timeline. So we'll do Melinda and Christina, and then I'll be done with the introductions here. Melinda, if you want to introduce yourself, you're welcome to. Otherwise,
you can see how.
Okay, and Christina.
There's a lot of people there.
All right.
Yeah.
Oh, there you are, Christina.
Yeah, I'm just, I'm a retired nurse practitioner, and I used to work with you at Sunnyside back a long time ago, 2015. And I just really want to stay involved in whatever capacity. So I think this is really great. I want to hear more about what you have to share.
Perfect. Thank you all for being here. This is, I mean, it really is. I mean, for these virtual coffees to be more of a neighborhood gathering. So I do want to just acknowledge that I want everyone to feel like you can jump in. And I also want to make sure we get through the questions. So I noticed most of you are already Zoom savvy and have turned off your or gone to mute when you're not speaking. We will leave it that way so you can unmute. If we start having any issues, we may just mute you. So please don't take offense to that. We just want to make sure that we can all hear. This is a really interesting time, obviously, for all of us, where we can't actually gather in the local sorry, something just flashed up on my screen. So in the local coffee shop, however, what we're seeing is that people are actually getting more engaged in a lot of ways, because it's not the barrier of getting out of your home or finding where you're going, or just not feeling comfortable in a group setting. So it'll be an interesting session, because there is the potential that we'll have more public engagement through a virtual means than we would if we were in the building. And there is privilege associated with being able to go to Salem, and there's also privilege having the internet connections and the opportunity to do this. However, we really are striving for that to not be a barrier for folks across the state. And there's a lot of work going into that right now with all our kids trying to learn remotely. So I think what I'm going to do is ask Peter to just feed me the questions so that I'm not getting distracted trying to read the chat and look at the pre-sent questions. Those are where we're going to start. We're just going to launch in, and some of you have touched on some of these things. So Peter, I'll actually start with the vaccine issue. I am the COVID-19 subcommittee chair, which is a remarkable honor as a freshman. I know that my experience as a physician who's caring for COVID-19 patients, and my leadership in prior lives at Northwest Permanente is why the speaker trusted me, or at least part of why she trusted me. I won't speak for her, obviously, with that role. And so it's going to be one with a lot of informational hearings and trying to set the stage for why we're making the choices we are and where things are. I believe that we will get to accountability, which is really the second role, is policy making. Any COVID-19 specific policies will come to my committee. but also government oversight. So it's really oversight of the executive branch, which includes the OHA. And there's a lot of folks who have, differences of opinion, whether it's vaccines or how we're testing or how we're treating. And really what I want to get to is just transparency. We want to understand where we are in each county, how things are going, how are the experiences of people who are in long-term care facilities or people who aren't English speaking who are trying to access vaccines. And so that's really where my focus will be, is bringing in stakeholders who aren't usually in the Capitol or haven't been, accustomed to doing that, so that we get their perspectives, and then just using data, because through data we get to accountability, and it's much less divisive, I think, if we focus there. So, and then I'm also serving on the Judiciary Committee, and the two subcommittees are my COVID-19 and the Equitable Policing Subcommittee of Judiciary. So those of you who are talking about racial justice and some of our criminal reform endeavors, that'll definitely be something that we'll touch on. So Peter, I'll ask you to tell me the first question.
Yeah, so the first question we have is, when will we know when seniors can really get the vaccine?
Great. So the governor, as I can't remember which of you spoke to it, maybe Eve, has said that the first group of 1B, which 1A is all the healthcare workers, emergency responders. We've kind of heard a lot about that. We're about 2/3 through that group across the state. The next group is 1B, and she's going to start with our educational staff. So not just teachers, but all staff who help our schools run. And the counties are going at a little bit different pace depending on how far they've gotten through their 1A population. So some counties have started vaccinating teachers. I believe the Tri-County area will start in the next 1 to 2 weeks. And I don't know, Peter, if you can just show in the chat, or actually I will actually share this in the chat if I am able. There is a link that you can go to find out where you are in the prioritization, or at least what the prioritization is. And there's a tool on the COVID-19 website for OHA that you can go to get all the information that you can. So again, this requires that you have internet access, but this is the overall link for COVID vaccine. And things are different depending on your county. So it's not going to be like, Coin News can tell you where to go that day, because it really will depend on where you live. So yes, teachers are going, or educational staff are next, with the hope that we get our children back into classes. I'm not going to pretend that's not a controversial issue. Certainly, I take care of people who are really scared. We've got a lot of my elderly or older patients who have been waiting a long time to see their grandkids or to be able to leave their home and feel safe. And so, and they are at most risk if they were to get infected of getting seriously ill. So that decision is one with our kids front and center. The importance of getting our children back into school is paramount for the governor. And I believe that that's a well-informed and really hard decision that she's made that I support. I know that we are never going to do all the right things. And really, the barrier that I would like us to focus on most is our federal government supply chain. Like, we need to figure out how I'm hopeful with the Biden administration that this is going to start ramping up pretty quickly. But both Pfizer and Moderna are not on track to deliver the 100 million doses each that they or 100 million vaccines. So 200 million doses, but 100 million people each. They're about 40% under target right now each. So we've got a lot of work to do to mobilize our supply, because now it's not a issue of being able to get it out as much as it is of not having the supply to get it out. And I probably got into the weeds too much there, so I'll try to be more efficient with my answers next.
In the vein of vaccinations, we had a question about the vaccination volunteer effort that you're leading. Can you kind of explain what that is and maybe why people that have signed up haven't heard back from.
Yeah. Great. So it was a very loosely, to say that I'm coordinating anything. Really what happened is I'm in contact with the operational group who is doing the Tri-County. So the 4 major insurers who are doing the convention center vaccine mobilization. What they were saying is we've got a lot of doctors and nurses and medical assistant, or actually I don't think medical assistants can do it, but some of the other groups who can vaccinate, we have those volunteers. What we don't have are non-medical volunteers, people to direct traffic, make sure people know where they're going, get forms filled in, wipe down chairs, all that. And so they were looking for those volunteers, and the state doesn't actually have a database for that. So Peter, the voice that you're hearing is a whiz with Google Forms. And so we just set it up, and there's a lot of interest in expanding that. And yet what the health systems are doing right now is figuring out how they're going to do the background checks and how it's most efficient for them to get in contact to schedule those volunteers. So just be patient. We are very excited for all the folks who have signed up, and we will put in the chat the link if you want to get signed up. It's going to be a many-month endeavor. This is not a 1-week opportunity. This is going to go on at least through the end of the year, I would imagine. So please just sign up and know that your name is not going to be lost. We're just trying to let the health systems kind of get their feet under them, and they have the volunteers that they need for the first couple weeks. So it'll probably be within the next week or 2. This next question.
Great. Now, then the last question that we're going to have on COVID is about the new strain that has shown up in the UK as well as some places in the States. Are you, as a physician, are you concerned about that strain? Do you believe it to be more lethal? And how do you think that that may impact the vaccine distribution and our public health guidelines so far?
Great. So it's been named. It's a B117 strain, and it is highly infectious. So it spreads more easily. It is not, from what we can see, at least in the UK, more severe in the illness that it induces, and that's fairly common. Usually, viruses mutate. Or they always mutate, but usually if they mutate and become more infectious, they lose something else. And so we're not likely to see one that's as infectious and highly lethal or, more scary than what we've seen. I say that, knocking on wood, hoping some such thing doesn't happen. There are reports of other new variants in South Africa and other areas that are concerning as well. So this is, all I can say is this is a long viral season that we've already been through, and I wouldn't be surprised if this keeps going for just as long. We've got to get the vaccines into our communities, and yet we're not sure if the vaccines are going to work against the new variants. So far they are. There are reports that there are antibody resistant viral infections. I don't know if those are substantiated yet. So lots of news that comes out is not based in real science, or it's based on a single story, which sometimes isn't the real story. So I would just really remind people as we go through this hard time together to be calm, be kind, and be safe. And that really comes into play as people are trying to get the vaccines. Just being understanding that we all want to get our family members vaccinated, and there's only a limited supply. And so we're making hard decisions. And as I believe Eve did say, if you can hunker down at home and stay distanced from people, wear your mask if you're outside, and always wash your hands. I know that that's the mantra we've been saying all along, but that's really back from 100 years ago when we had the 1908 epidemic or pandemic. That really is how a lot of communities got themselves through too. So we haven't really reinvented the wheel here. We've got this amazing vaccine, and yet we also are doing the old-fashioned things that really work.
And just quickly before we transition to the next topic, I do want to acknowledge that we did receive a lot of questions about COVID, and this is a really important issue for the representative. However, we do have, unfortunately, a relatively hard stop at 10, so we are going to transition to another topic just to ensure that we can cover all the work that the representative has been doing since she's been in Salem. But rest assured, COVID response, relief, and ensuring safety for all Oregonians is one of her, if not her top priority. So with that in mind, I'm going to transition over to, we did receive a lot of questions also about the environment. And one person that was asked a question prior to the Zoom was interested in you talking more about your indirect source bill.
Great. So when I ran, healthy lives, healthy communities, healthy environment is my mantra, and that's not going to change. I've got young children. Well, they're not so young anymore. They still feel really young, but 14 and 17. And we have to take care of this earth. And so clean air as a pulmonologist is a real priority for me. And Mary Pivoto from Neighbors for Clean Air is a friend and a colleague, and is someone who I trust greatly for her leadership. And so she really helped bring the indirect source regulation or DEQ regulation bill that had been a petition in 2019 that was really pretty much ready to go. And so that is the bill that we're bringing forward. Peter, if you can put in the chat, or Emily, if you can pop in with the HB number, I can't remember offhand, if people want to follow it on OLIS, which is a whole nother thing, but you can sign up for bill alerts so you know when it's going to have a hearing or when there's materials posted on the legislative website. I would encourage anyone who's interested in certain topics that we talk about today to reach out to my team, and we can share that information about bill numbers and whatnot, so you can get those alerts, because we will want public testimony and involvement, letters to our office. I guarantee you, Lauren and Emily and Peter, who are my team who are on here, looking at every letter and making sure that I'm looking at the responses that we're sending and editing them as needed. So as far as the indirect source bill, what that is the majority of our diesel fume particulate matter is coming from not roadway traffic now because of regulation changes to diesel engines, but really from construction traffic and rail yard traffic and ports and airports. And so what the indirect source rule would be a process for DEQ to regulate how much pollution is able to be emitted from an area. And that is going to get to the bottom of a lot. The problem with that is it requires infrastructure upgrades. So the engines that people use in construction areas is often 20, 30 years old, and it's just not up to the standards that we need. So it's an enormous lift for industry. And so there will be a lot of pushback on that bill, and yet we've got to take care of it. And so if there's any of you on this who are clean air activists, please sign up for this bill. We are going to need a lot of work to get this through. It's really, it's a major policy change. All right, Peter.
And in the same vein of environment, we also received several questions about Representative Karn Power's bill for 100% clean electricity. And a lot of the constituents are wondering kind of what your take is on that bill, and if you're familiar with the bill.
So I'm familiar with it as much as, I've talked with Rep Power and Rep Pham, who took, I can't remember if it's HD 46, but it's Alyssa Kenny Geyer's prior seat. And she is also a environmental activist, super involved, and is, I believe, a co-chief sponsor, but she's at least a co-sponsor of that bill. And that is our major lift for this session from, my bill, their bill. There's a lot of bills, but I know that that's really where their focus is right now for the two of them. Actually, I shouldn't say that. They have multifaceted foci, so I shouldn't speak for them. At any rate, the 100% renewable, it really is investing in an economy that is sustainable and not based in fossil fuels. So we need to upgrade our infrastructure. We need to invest in job training and expansion of the workforce to have the skills that we need to build the renewable economy. I cannot speak to the specifics of the bill, but I'm 100% behind that. This is absolutely where Oregon should be leading. If we don't lead in a renewable energy industry, we will fall behind and we will never be able to set a precedent that we are an economy that's ready to move forward. With our coastal area, we have so much impact from pollution in our oceans, and we also have the opportunities that the ocean provides for generating power in addition to our hydro and other areas. So I think that we have the opportunity as a state in this nation to lead, and I really challenge us with our representatives who are leading this effort to make some pretty courageous decisions, and hopefully we can all stick it out and get it done.
Now, shifting gears again, we also received several questions about your colleague, Representative Mike Neerman, and the actions that took place during the third special session in December, and just kind of people wanting to get your take on it, and what the legislature can do about what occurred.
Yeah, the first thing I'll say is thank you to all of you who have sent your, concern or your, just bolstering us all, because it was a challenging period. I know a lot of my colleagues were really, frankly, worried about going into the Capitol and the safety of the Capitol after that. We were all there on December 21st, I believe, for a special session. And I was actually in the stairwell coming up to the second floor and heard a bunch of pounding, but it was in a different area, and hadn't heard what was happening yet. And then there were a lot of representatives on the second floor who were looking off to the side, and people were scared. Like there were, I would say probably 40 or 50 people in the courtyard in the area where everyone saw on the news. And they had taken some metal crowbars and pipes from a construction area right behind there in the courtyard, and were using it to break down the doors. Representative Neerman is recorded, so I don't, he's alleged to have let people in purposefully into the building. Whether that's the case, I am not speaking to, but he did walk out the door and subsequently people came in. There was an upgrade to Capitol security, I believe in 2019. So there were cameras all throughout the area. And so the State Patrol was monitoring them. They're live monitored and saw right away that people were coming in, and were able to confront before they got into the Capitol. There was someone who pulled a fire alarm, and a bunch of us started being told that we needed to evacuate. And then they came running back saying, no, someone's trying to get you to come out of the building. So that was a little concerning. And they had there had been some bear spray or some sort of toxic chemical that had been sprayed into one of the stairwells where people were going to exit during the fire alarm. So there was a lot going on that day that really was disconcerting, especially for our BIPOC caucus members. It was very much a group who's not interested in equity. There's alleged a lot of white supremacy groups who were there. So that doesn't really set the tone for the people's house that any of us feel comfortable with. So the State Patrol has made a great effort to make sure that we're all trained, that we're all aware of how to take care of ourselves and to be safe in the Capitol. And there was a very strong presence on Tuesday or Thursday when we were in the Capitol. And there were no problems. So I'm confident they are aware of the issue. I'm confident they're addressing it as well as they can. And in the context of what happened in Washington, D.C. on January 6th, I think that there was great concern, which delayed our starting the session until Thursday this week to make sure that we kept people out of the Capitol for Inauguration Day and the 19th. And Fortunately, so far things are going smoothly. The Senate convened yesterday without any major issues. So hopefully we will continue in that vein. But thank you for your concern. As far as Representative Neerman, there's official investigations, there's other investigations. We certainly are calling for his resignation. I will stand by that. It's the people's house. We should follow the appropriate rules to keep the legislators who are doing the people's work safe. And right now, we unfortunately are not able to have an open Capitol until that is something that we can be at least sure of as much as you can be. It was a very open Capitol, as those of you have ever known. Like, I was shocked when I came to Salem the first time and could just walk down a hallway and see where all the representatives and senator offices were. So I want us to get back to that. It needs to be truly the House of the people, and I will support the efforts that we all want to take to make sure that that happens again.
Great. Now, I would like to kind of transition us into just ensuring that you have time to talk about what you specifically are doing this session. We did have some questions about what you're doing for healthcare, what you're doing for workers. And so if you want to talk about kind of the work that our office is doing, then if there's time afterwards, we can field back the questions.
Great. So Peter is one of my legislative assistants, and he, with Lauren Morrison and Emily Pfeiffer, who's my chief of staff, have been amazing. And we also have an incredible intern from the neighborhood from the HD 33 district. So first and foremost, none of this work gets done without these folks. And so I just want to really share my gratitude for this team. We have really leaned in and are ready to go early. The work that I'm going to do is really going to focus again on healthy lives, healthy people, and healthy communities in a healthy environment. So healthcare, my major bill, we have several, but I think it was Joe Lopez. It's a huge lift. It's payment reform for our public employees, so our OEB and PEB members. It is moving to a global budget away from fee for service. So when you go to the doctor, they charge you a certain rate for that visit. And if you have, some skin lesions frozen off, you get an extra charge for that. And then there's a charge if there's an injection into a joint. That is not how healthcare should be delivered. I believe that a global budget, which means that for each person, you ensure they are paying a certain amount to the healthcare delivery system to take care of them. And if you do that, what you do is you incentivize the system to keep people healthy rather than making more money when they're ill or they need things done. And so we've become a highly high utilizing but low health community across our nation. And what that is a result of is people coming to have standards of care that are doing a lot of things and not focusing on how we keep ourselves healthy. So lots of words to really say that if we move our payment system to be in alignment with what we're trying to do, which is keep people healthy, we will all do better. And it's less expensive because the system doesn't have perverse incentives for charging more to do more. And then once you start doing that, people have the expectation that that's just how it's supposed to be done. So our public employees have rich benefits that I have no intention of trying to shift. This is not a cost-cutting endeavor. What this is taking the same pot of money that we are currently putting into healthcare for our public employees and then dividing it by the number of members and paying per member per month to the insurers, who then get that amount of money, and it's putting them on a budget. You get this much per month for taking care of this population of people. If you do well with that, you make money. If you do poorly with that, you lose money. And that puts them at risk for managing costs. people worry that that means that they're going to just not do enough to take care of us, we make sure that that doesn't happen by holding them accountable for service and quality metrics. And that's what Medicare Advantage plans do now. It's what Kaiser Permanente does. This is a system that I believe in, and it works. So if you know that people need to have certain levels of quality outcomes and they have to have high quality service, and that's from the members, then the systems will not be allowed to continue to ensure that population if they don't achieve certain levels of performance in those metrics. And the Medicare Advantage plans have 5-star ratings, and those that have 5 stars are the highest quality, highest service systems. And that's how you also allow consumers to be informed about how they're doing. So I want to move basically all of our public employees, which is about 200,000, a little short of 200,000 lives, into this payment system. Nothing else changes. The insurers can participate. We won't change anything about their benefits. We are definitely, it's in the law that there's no cost shifting, so you can't increase premiums or decrease coverage. So the whole system is just shifting so that the payment structure changes and puts it in the lap of physicians and their patients to make decisions about how you give care. And as a doctor, I know like those prior authorizations, all those things can go away because you trust the system for the clinicians to take care of the patient with the right care at the right time. Really long-winded, but really it would be a fundamental shift. Fee-for-service medicine has to go for us to be able to get to a sustainable healthcare budget. Right now, the more you charge, the more you make, and nobody wins in that system. So we have to put our healthcare systems on a budget. So that's what we'll do. As far as healthcare, that's the major one. I also am working on an electronic health record. We all need to have the same health record, or at least the ability to move information between systems. I'd like us to get to a portable market. Single payer is my goal. Each of these steps are where we need to go to get to a single payer, at least a universal system that anyone can go anywhere to get care. So that's the goal. And these are the strategic steps that we need to take to get there. I don't believe that we are going to be able to get it done in one fell swoop. So changing the payment structure, changing to have an electronic health record that you can get anywhere are 2 steps towards this plan that need to happen this session, I think. Environmental, we have a huge number of environmental bills. The indirect source one we talked about. We also have an HVAC system upgrade so that public buildings in the time of wildfire, as well as residential buildings, are safe and that you can actually get refuge from air toxicity indoors. We have multiple plastics bills. So I have been deeply concerned about plastic, and that you can't even go anywhere or buy nearly anything without plastic for decades. Oh, my cat's going to make an appearance. And we want to move away from plastic single-use items. And so when you go to the grocery store and you get to-go food, or you go for takeout at one of our amazing carts, you oftentimes are getting things that are in plastic, and we want to move to a truly sustainable packaging system. And so one of our bills is going to do that. Another one is plastic to fuels recycling plants are not actually recycling plants. It's really using horrible toxic chemicals to break down plastic and turn it into a fossil fuel that's then burned. So it's not at all an environmental recycling option, and we want to actually make those so no further permits are given to build those facilities in Oregon. And then we have truth in recycling. Multiple folks have brought a truth in recycling bill so that packaging is not allowed to be deemed recyclable unless it truly is recyclable locally. And the little triangle that everyone sees, that I have a hard time remembering which one is recyclable and which one's not. That's kind of by design to make you think that all of it's recyclable when really it's not. So that is a bill that I'm working on. These are components of the extended producer responsibility bill that Janine Solomon is working on, Representative Solomon. And so we strategically decided that I would take some components of her bill that we think are really important and take them as single policies, but really the major bill that we want to get passed for recycling and plastic consumption and shifting to renewable or sustainable packaging is the EPR bill, is how you'll hear about it. But it's a major omnibus package to protect our environment from the plastics that are killing our oceans and killing the earth, quite frankly. So it's a major lift. And so I will do everything I can to support Rep Solomon's policy. And then if it's not going to go and we need to take some smaller wins, then my bills will be there to support that work. Finally, worker protections. I feel like I'm just talking endlessly, not answering your questions. Worker protections. I take care of patients all the time who are having exacerbations of their heart and lung issues because of air quality concerns. And with our wildfires, it became a huge concern for a lot of folks. So we have outdoor workers, think our farm workers, our road crews. They were working on the 205 bridge during the wildfire, and having laborers out there doing road work during the midst of this, air quality index greater than 200, 2 to 400 was kind of when they were outside. We can't have that happen without protection. So it's a bill that would require that employers of outdoor workers know what the air quality is in the area where those workers will be and supply appropriate respirators if the air quality index is greater than 150. And if it's greater than 500, that they're really encouraged not to. We didn't ban outdoor work, but we strongly discouraged it and required that all workers wear a respirator. You can't really require a worker to do that, but over 500, it is so critical for physical health that they do that we did make that requirement. And so that will go through the Business and Labor Committee. And then we also, for those of you who wanted to talk about racial justice, I'm really concerned about that. That's how I believe I ended up on the Judiciary Committee. I've been doing a lot of work with Rep Bynum and Rep Sanchez and Senator Przanski and Senator Dembrow and Senator Frederick and Senator Manning around our Department of Corrections and what we're seeing with COVID in those in our adults in custody. And we also have a real healthcare problem in our correctional facilities. And so one of my bills is to do a pilot project at Coffee Creek Correctional Institution, which is where our women go, to give health navigators to each person as they are brought into the facility, who is responsible for making sure that their healthcare that they had outside of the correctional system is continued, that they get their medications, and that we demand or expect, I should say, that and make sure that they get community level access to care, including reproductive health care, so that there are no barriers. Right now, there's some pretty significant barriers to women and all adults in custody, but especially for reproductive health care, women being able to get access to quality prenatal care and abortion care. And we need to make sure that they have full spectrum access to that. So that's what this bill is trying to do. I'd like to cascade it throughout the correctional system to all adults in custody, but we decided that starting with Coffee Creek gave us an opportunity to learn what works best and then cascade it throughout the state. So those are the major areas. Peter, remind me if there's anything major you think I missed, but I do want to get to a couple more questions if we can.
I'm biased, but I would personally say the youth suicide reporting bill is also
Oh
a pretty
my
big one.
gosh. Yes, it's a huge one. Sorry, thank you. So Peter has been working on this a lot. So we're working with Multnomah County and the Tri-County area to mandate that if a youth up to age 24 commits suicide, it doesn't fix the underlying huge mental health crisis that we have, but it allows the community to be notified that that youth from their community committed suicide, so that those groups, whether it's schools, activities, other community church groups that they are involved with, can be notified so that there can be further mental health care delivered to the other folks who would be impacted by that. So it's one, reporting so that we know. A lot of youth will go to Multnomah County, for instance, from outlying areas. And if they are unfortunately successful in committing suicide, their home county may never know. And so there could be significant burden of youth suicide in an area that that county wouldn't know. So it's mandating that the home county be notified, and then extracurricular activity groups are notified as well, so that they can deal with the ripple effects of teen suicide, which is a huge issue, especially for those of us with teenagers. Like it really shocks a community, and it can lead to increased suicidality amongst those peers. Thank you, Peter, for reminding me. All right, let's try to do a couple more questions, if you can kind of scan them for which ones are the most dominant themes.
Yes, I think now is kind of a relatively good time to go back to vaccine, because we did receive a lot of vaccine questions, and a lot of them kind of revolve around the rationale that the governor's taken to prioritize educators over those, not necessarily just elderly, but those more at risk of COVID fatality.
Yeah, I just saw Emily, thank you, remind us that we have time for 2 more questions. So I will say that there's no right answer to this. My major frustration has been, at first we had great supply, or we had plenty of supply of vaccine, and we were really rigorous about the order in which we were delivering that. And so it slowed us down initially. Now the distribution of vaccine is not anywhere near as much of an issue. Our communities, our pharmacies, our healthcare providers have really been able to rally and get vaccine available to groups. We still have a lot of challenges there with long-term care and adult foster homes in particular, and our communities of color who don't speak English. We are not getting to our Black and Brown neighbors anywhere near as efficiently as we are with those who are white and privileged and able to follow the internet. So we do have issues, and to talk about the prioritization is really to make value judgments. And anytime you do that, you will find a lot of conflict and a lot of disagreement, because what we are doing is distributing a valuable resource in a prioritized or preferential way. And what I very much support our governor in is holding equity at the forefront and health. And she is not making a decision that seniors aren't valid and critical and important to vaccinate. What she's decided is that the challenges that our children are seeing and not being able to be back in the classroom is a priority, when, as Eve said, I believe, that many of our seniors can stay home and stay safe in the way that they have. That is not true in congregate care settings like our nursing facilities and assisted living facilities. So there are discussions around, at what level do some seniors go versus others, that there's no way to win this discussion. There's just not enough vaccine. So this all goes away if we can just get the supply to increase, which is really where I am hopeful. We have Johnson & Johnson and AstraZeneca coming up for FDA discussion soon. Dr. Fauci, I believe, had said that it's expected in the next couple weeks. And the Johnson & Johnson vaccine is a 1-dose vaccine, and that may be our best option for getting people vaccinated. I am going to stand behind the governor on her decision to prioritize teachers. I'm concerned, I will admit, that it isn't going to get our teachers into classrooms any sooner, because there are other issues. You know, if you put teachers in a classroom with lots of kids, those kids are going to be okay and the teachers will be okay. But that community that those children then go home to in multi-generational families, I'm concerned about those aunties and uncles and grandmas and grandpas who they are engaged or living with, that they're going to get sick. So I think that we're going to end up vaccinating teachers and then vaccinating seniors and not getting to kids in classrooms until that happens. That's my uninformed anticipation of how this is going to go. And in the end, is there room for disagreement on whether teachers should have been prioritized? Of course. But that is the decision that the governor made, and what I will absolutely 100% applaud is that she made a decision. Indecision is more difficult and hard to follow than anything. And the governor has been a leader in this area, and I am really proud of the hard work and decisions she's made, and it is thankless. And I just ask everyone again to be kind, be calm, and be safe, and just keep yourself safe while we're waiting.
For the last question, I'll keep it on vaccines, but it's a bit lighter topic of just people wanting to know where they can get this information, where the state is getting this information, and how people can stay informed with the status of COVID-19 in the state, as well as the status of the vaccinations in the state.
Yeah, so I shared earlier, and if Peter, or Emily or Lauren, if one of you can drop the OHA vaccine informational page in the chat again, or if you just Google Oregon Health Authority or OHA COVID, it'll come right up on Google. And thank you, there it is. That is the most up-to-date place to go. All the health systems are filtering people to that. There is a tool that can help you assess whether or not you are able to be vaccinated yet. It will have a scheduling, if it doesn't already, I haven't checked it in the last few days. It will have scheduling capability, or at least telling you who to call or where to go to get scheduled. This is going to become, this is a huge effort for OHA. They're putting a lot of energy in making sure that this is usable by the public. They have the information on the website in, I think, 13 different languages. So you should be able to find appropriately translated information. If you are having a hard time, please reach out. My email, Peter, I'll ask you to put it in there, but is rep.maxinedexter@oregonlegislature.gov. It's the longest email ever, but you can remember it for any of us. It's just rep, or REP period, or SEN for senator period, and then our names, and then at oregonlegislature.gov. We look at our emails every day. I am answering, as with my staff, all the emails that come in. So if you send us a note that this isn't working, or you can't get translation of to a dialect that you need, please let us know. We will also have our newsletter. So if you send an email and ask to be on our newsletter, we will send out for HD33 all up-to-date information, and we will just blast those out and put them on social media as soon as we get it. So when we transition to teachers, we will alert you, and I believe that's going to come up this next week. And again, it's educational staff, it's not just teachers. And then when we transition to 80 and older, which is the next group, we will alert you. You can always get to me through Twitter and other means as well if you're on those things. And we really want to make sure that everyone has education about the vaccine, has access to the vaccine, and then makes a good choice about whether or not it's right for them. So this is something we're going to do every other Saturday, 9 a.m., 2 weeks from now. Join me again. I really want to hear from you. We'll figure, we'll make this more conversational when there's a smaller group, and more question and answer when there's a bigger group. And I'm grateful for all of you being here today. On the Fridays, on the Saturdays, we don't have the virtual coffees, we'll send out a newsletter the day before. So we'll be in contact with the district every week. It is my absolute commitment that I am going to be a true representative of my district, and I really want to hear from you every week if I can. So please let me know what I can do for you and what's happening in your lives, and I look forward to seeing you in a couple weeks. Thank you so much.